tell us broadly about your role in Medicine X?
I'm Director of Technology Discovery, and my job was putting together a team to find really cool companies and startups that were very inspiring and essentially showed the future of where medicine may be going. We reviewed quite a few companies, over 100, and it was quite compelling, and the future looks very, very promising. So that's a lot of what I did. We had an amazing team.
Yeah.
It was an interdisciplinary team, medical students, physicians, there was VC, engineers, almost about 9 different people, all looking across the U.S. We even had a couple international submissions to see if they'd be appropriate for this audience, which is quite diverse, as you know.
Right. And what is the role of these innovative tech companies here at Medicine X?
The role is to focus primarily on concepts. We didn't really think about business models as much as just introducing new concepts to the audience. In particular, this is a really diverse audience. We obviously have patients, physicians, researchers, technocrats. So finding companies that resonated with all of those different diverse groups was definitely challenging. But ultimately, we were looking for things that we thought would make people just go, wow. And I want that. I want to use that, and I think there's a lot of value with having these types of technologies. And I think all of us are here to admit that there's a huge gap in the way medicine is delivered currently, and we're looking for solutions that may be able to fill that gap.
And can you talk a little bit about, an example of one of these companies that you're particularly excited about?
One is Nutravice. We found them. They're one of the StartX accelerator companies. And what's especially interesting about them is that it tackles the problem of eating healthy, in particular eating healthy while you eat out. And a lot of us, we like the flexibility of eating out, but a lot of times when we do that, you compromise on eating healthy. And their technology leverages quite sophisticated machine learning algorithms to go through a lot of the specific ingredients of dishes, making recommendations that are custom to your needs based on lifestyle or even clinical conditions, with geolocation and sharing, and it's quite phenomenal. So in terms of a nice sweet spot for this audience, I think it would resonate with everybody, from the scientist to the person who just wants to find a good dish.
Right. So it sounds like the products of these companies are very easily usable. They're applicable to everyone's lives. You don't have to be a physician. You don't have to be a techie. You can just be average Joe and you can still use them. Is that correct?
Yeah, exactly. And I think that's a really important concept, that it's simple to use. Simple and effective, obviously, but the simplicity and elegance of the design is a critical component, and something that, again, would draw us and we hope other users, because a lot of times people have some great ideas and they get over-engineered, but making things simple to use for the end user, but on the back end focusing on the really heavy lifting was something that we really enjoyed seeing some really brave entrepreneurs doing some amazing things.
Yeah. Well, that's great. And would you say that's one of the things you're most excited about for Medicine X, or what gets you going about this conference? What makes it so unique?
I think the diversity of the audience and the attendees and the panelists, because this is really you're dealing with some serious conditions, and you're bringing patients who are living with a condition. You're bringing the physicians who normally manage that. You're bringing researchers who are studying that. You're bringing in investors who are trying to think of finding companies that are tackling that problem. You're bringing engineers who are working on solving it. So bringing this almost cross-pollination, diverse audience, all focused on either a specific problem or specific condition, you can't even predict the fruit of that dialogue. So having that all right here, having it at Stanford University, right in the heart of Silicon Valley, it's the best place in the world to have something like this.
Right. It seems like a great exchange of ideas is taking place right around us right now.
Yeah.
If you just look around, it's great. I feel like I can almost see people's thoughts just kind of going and seeing all the new ideas springing up.
Yeah, no, definitely. And even in our last discussion, and there was a self-tracking panel that they had. A lot of the panelists were talking. Right next to me, I could hear people say, "Oh, we got to study that observation." You know, it was a researcher. I had no idea. It's like, that's a very interesting observation. It's like, let's start looking into that, and things like that. It's a nice place to have. It's a great platform.
And what is kind of the long-term goal for Medicine X? Like, what sort of impact are you guys hoping to have in the long run?
The goal is to create a nice nexus to constantly bring people thinking about how technology is going to be shaping the future of medicine. Technology is evolving constantly, but we all recognize that technology is only a tool. Really, it's about the people and about the problems and the evolution of how we start tackling those problems. Because as we tackle one problem, we're going to uncover another. It's a continuous process. And ultimately, it depends on having all the right people, some really smart people from diverse backgrounds thinking about solving these problems.
Right. And hopefully some of those solutions will be born right here.
Something that's really important is if anyone sees any technology that they think deserves having a platform here, specifically a young startup, just to email me. Let me know and let the technology discovery team know, because our job is to curate all these different companies and source them, and our hope is to give them a platform to share what they have with the whole world.